statements, and then we'll be happy to take questions.
Yeah.
Dr. Dobbs?
Yeah, thank you. First off, I would like to thank everybody for social distancing and then wearing your mask. If everybody did that across the state, we'd be in really good shape. Which that gets kind of into the first thing I want to talk about, is that we're not in good shape. Today we recorded 611 new cases. I would anticipate higher levels like that going forward, and even increases. And there's no reason to think that it won't continue to increase, because what we're seeing is we're seeing ongoing transmission in the community. It's moved on from these point outbreaks where we see it like in a plant or in a nursing home or some other scenario like a funeral. It's just become widespread in this setting where people have pretty much recklessly abandoned the principles of social distancing. It's a little bit lamentable, because if we do just some of the simple things, if we do 6 feet of mask in small groups, we basically would see coronavirus start to fade out. But because we lack the patience or discipline to stick with those sorts of things, we're going to see ongoing cases, and I'm really fearful going into the fall that it's going to be an absolute disaster. Very, very concerned. There are no indicators of anything that's going to let up on this for us. It's summer, right? Everybody was saying it's summertime, it's going to back off in the summertime, and has it backed off in the summertime? Not in the least. It's continued to increase. And there's several things that we might see. Not only is it going to limit our ability to have some of the things that we want to do, and is it going to impede our ability to educate our kids? That's something we worry about a lot. But also, is it going to overwhelm our health system? And if we continue on this trajectory, absolutely, we will overwhelm our health system. I get reports every day about people who don't have the resources that they need. I had one yesterday about a woman who had a fracture, and she went to the ER, and they couldn't find a hospital for her because everywhere was full. They did finally find somewhere for her, but it took hours and hours. And we're hearing about people having to spend ICU stays in the ER. Right? ERs are busy enough; they don't need to be ICUs also. So I just want to be very clear and warn everyone that we're looking at really a bad scenario because we're not able to do those simple things. We really do need to follow the guidance that exists, the current executive orders that limit gatherings, and on a personal basis, the smaller the group, the better. I would like to reiterate that there are ways to do things safely. There are ways to get back to work in a way that can be done and that you don't transmit virus. The Department of Health, we've been working this whole time, and we've had people in this building, but we have developed processes and safety measures that would minimize transmission, and thus far has been very successful. The other thing that I just want to go ahead and acknowledge is apologize for the gaps in data reporting. We did have a period of time when we were unable to report data. And as you can imagine, we've accumulated a lot of data elements. With over 22,000 cases, and then a lot of information on each case, within that database is over 14 million data elements that have to be managed. And that's just the ones that are finalized. It doesn't include additional data coming in. So it's really sort of a monumental task. We were using an older software system that was implemented in 2009. It was not designed for this process. And if you combine that not only with all the negatives that we're getting in and the fact that it's running a little bit of an older software, we basically ground to a halt last week, and we're unable to get data and extract data in a way that we could really confidently report results that we felt were accurate. And so rather than get information that we didn't feel comfortable with, we'll just take the heat and stop until we can get something fixed. We have transitioned to a process that bypasses those issues, where we can extract it in a different mechanism using a more modern database format where we can get those numbers. It's very labor intensive, and I would like to applaud my team. My folks haven't had a day off since the 1st of March. Not a one of us has had a day off. And they were up all day, into the night, early in the morning, just pushing along. So I just really want to thank them for all the hard work they've done. But it's so very important that we're willing to make that commitment, that we can get the information that you guys need, that the counties need, that the local leaders need to help make decisions for their community. So just know that we're committed to doing that at whatever cost, as far as like effort and our resources. And additionally, we will be looking for an updated, upgraded sort of system so that we can have a little bit more robust capabilities as far as data reporting. that's really the main things that I want to just mention today up front, but also to make myself available for questions because I know we had a chance to meet in a few days. So appreciate y'all being here.
Dr. Dobbs, what is this going to mean to the school systems? How is it going to affect education?
Well, I had a great meeting with the superintendents today. You know, I do think that we can safely educate kids, but we need to have the communities with lower levels of transmission so that they don't bring it into the schools. And then we need to be careful in extracurricular activities where kids are going to be gathered in groups. So it worries me that because we're engaging in silly behaviors, things that we want to do, I get it. People want to go to parties, people want to go to crawfish bowls, they want to do block parties and all that kind of stuff. But is it important enough to undermine the foundations of our education system and our healthcare system? And I say absolutely not. If we really want to make sure that we can take care of our communities, take care of our kids, take care of our sick folks, we just got to do those simple things. And if we would do those simple things, we would be in remarkably better shape.
One thing I noticed yesterday, I was looking at the RT website, was the transmission factor for the state has gone up. I think back in, what, April, it was like 0.9. Yesterday it was, or recently it's gotten up to, I think, 1.07. Now that doesn't sound like much, but it's above 1. Can you just kind of explain that to us, how that works and why moving that much is a big deal?
Yeah, so...
Because it kind of corresponds to what you're saying.
Yeah, oh yeah. So the whole R0 and the RT value, like in the reproductive rate. So it's basically, on average, how many does one person give it to? And on average, if one person gives it to less than one person, then you're going to be shrinking. And looking back at April, you know, our growth rate was on negative, so that we would have reported less number of cases every day, even in the context of doing additional testing. But we've kind of reversed that trend, and our R value has kind of scooped up, and now we're above 1, and that indicates that we have a growing epidemic in Mississippi with more and more cases.
And that means a an infected person is infecting more than one person.
And so it's going to be more of a geometric increase. So it's going to be multiplicative. So each one person gives it to 1.1, and that person gives it to 1.1, and then if we get to 2, it's going to be 2, 4, 8, 16, 32 sort of thing. So
and it's getting worse.
Yes, sir. Yes, sir. Getting worse.
You've talked on and on, as some people would say, till the break of dawn, about wearing masks in public. Every press conference, you've done that. The governor has also echoed what you've said, but he hasn't followed those directions. People aren't wearing masks. It's the bottom line. It's what it really looks like. People are not doing that. Is it time to mandate a mask situation in Mississippi? That's happened in certain counties, right?
Yeah.
There are some other states that have taken those steps in certain places.
If it would work, I would be supportive of it. But people are just not going to do it if they don't agree with it. And in some of these areas where we've been successful, in the counties where they've had real bad problems, and then were able to embrace the more strict social distancing and the masks, they've had improved transmission. It's worked. But if you don't have a critical mass of buy-in of the local leaders and of the community, it's going to be doomed to fail. So I do believe, especially for some communities, it'll get so bad that they'll say, you know, this is such an easy thing to do. You know, wearing a mask is not about my personal rights. It's about what I do to you. It's about what I do to the community. It's not a infringement upon my rights. It's me being selfless and patriotic because I love my community, I love my family, and I want to make sure that I'm not a part of the problem of transmitting viruses into the community. It's just the right thing to do.
Could that legally be bound in a mandate with the executive order? The governor could put that in place, and maybe there'd be some legal consequence for not wearing them in public.
Well, we have rules that people are violating now and are not enforced. It might actually undermine the order itself if it's just so routinely ignored that it would not be useful. There's got to be some buy-in from the public. You know, the mass gathering thing, every time somebody has a big party, it's against the law. And are people doing it? Oh yeah, and I've pretty much quit going to restaurants because it depresses me to go in and see employees not wearing masks or people in there not separating. So you know, a lot of places do great. You know, some places do fantastic. but, you know, some don't. And it's the law. And, you know, from a health department perspective, you know, we do regulate, we license, you know, restaurant establishments, that's gonna be part of our inspection process. But, you know, by and large, people are not following the laws now. And this isn't a Mississippi thing, this is a nationwide thing. And so, I'm feeling frustrated for our whole country. I'm actually not proud of how our country is responding to this, when all it would be is a little bit of common sense and caring for your neighbor. We could make a big difference.
Have you considered taking your inspectors, instead of, say, focusing on, you know, the ratings, inspections, A, B, C, D, say Friday, Saturday nights, having to make rounds of the restaurants?
Yeah, we're looking at things.
I went to one myself a few weekends ago. Place everybody around here is probably gonna know. 60, 70 people, everybody's sitting next to each other at these two long tables. Everybody's piled up outside, about this far apart. No mask, no nothing, nobody.
Yeah, it's disheartening, and you should leave. And I would say, I would encourage people of good conscience to, you know, vote with your feet. And, you know, certainly, and we're always open to complaints from, you know, restaurants, such that we can follow up on those. Yes, ma'am.
I have like a two-part question. In the national news, President Trump says there's an increase in COVID numbers because of a record number of increased testing. So have we increased our amount of testing? If, you know, and if we've increased, can you tell me by what percentage?
I don't have that with us, but we certainly, if you look at our testing, we've been pretty stable in Mississippi over the past month. We have a lot of availability, and we're meeting our testing targets. Even accounting for the amount of tests we've done, and especially some of the R-value calculations that we were talking about, they do account for testing volume. And even with testing volume, you're seeing growth. So certainly you will see more positive cases when you test more people. That's inevitable, but that doesn't explain what we're seeing. What we have seen is a shift to younger population, which makes sense, people going out. And our biggest sort of age cohort is going to be like, you know, 18 to 40. And if you look at what happened in Lafayette County recently, you know, over 80% of the cases were between the age of 18 and 23. That's a pretty small slice of people right there. So, you know, there is transmission going on out there. It's shifted to where it's happening, and I'm very concerned that it's going to start stepping up the age ladder, right? Young folks give it to their family, grandma, aunt, uncle, and we already have a health system that's strained.
How many of those up there in Lafayette County were, you had a huge increase in cases, but how many actually required, say, hospitalizations, ICUs, et cetera?
You know, the young
folks, do we have a lot of infections, but the severity wasn't that bad, or how did it work?
You know, we don't have them linked case by case by that necessarily, but if we look at the stresses on the health system, it wasn't any different. So it does fit our sort of narrative of younger folks don't get quite as ill and require hospitalizations. They do sometimes, but if we, you know, but young kids and young adults just don't get nearly as sick. But they are a part of the problem, and sometimes they do get sick. Yes, ma'am.
I wanted to ask you about 4th of July coming up, because obviously a lot of people are excited about getting together with a large group of people. What do you suggest for a lot of these cities that are going to have plans?
So we do have some sort of recommendations for 4th of July celebrations. We certainly encourage people to follow the law as far as outdoor gatherings and stuff like that. But if people stay in their car at a fireworks display and they're not out touching one another, then that should be perfectly safe. Kind of like the drive up, you know, church services. You know, it's being around somebody. It's proximity, it's duration, and it's touching, and it's really hard. Be disciplined not to go up and hug your neighbor. I know you want to. It's a beautiful thing to do, but it's just not the right thing to do right now.
And then with the trend that we are seeing right now, especially with the 600 cases today, is it looking like we're going to be wearing masks into September, October?
Oh yeah, we should be. I mean, I wouldn't expect any reprieve until the spring.
This is a new normalcy.
Yeah, I think so.
I want to go back to Lafayette County.
Yeah.
So what we're saying is the infections among the young people increased, the college kids increased, but the severity among them did not really go up that much, although it increased among the older groups because they were taking it home with them.
It may. It may. We haven't seen, you know, it takes time to cycle, you know, every 10 days or so.
If they're not, say, having to going to the hospital, ICU and all that stuff. When college starts back, is it possible to sit there and have them, say, in their dorms, have them just no staying off campus, stay in their dorms, are pretty much segregated from the rest of the world? You see where I'm going with this?
Yeah, and just keep, you know.
And then they can still go to class, but they're not really coming in contact as much with the outside, or going home and giving it to their parents.
Right. And that certainly would be a strategy that has merit. I know and we're going to be meeting with universities and colleges trying to talk over things. I mean, a lot of them would want for them to go home so they can get cared for by their parents and medical attention. But then that has those risks we just talked about. So,
And if they give it to fellow students, I mean, they get it, they have it, they shake it off and go, you know, get well. But if they go home.
and the other challenge is, you know, if you're sick, you don't feel that bad, are you really going to stay in a dorm room for 14 days? That's pretty tough. But yeah, no, it's going to be a real challenge, really. Yes.
So you have more than 600 cases today.
Yes. Yes.
You have nearly 1,000 deaths in this pandemic at this point. You have a surge in hospitalizations. We're one of 17 states that is having that surge, that strain on our health system. And this is summertime. What do you anticipate the fall, which is expected to be worse than what we have now? What do you think that looks like?
I'm extremely worried, as you can imagine. And if we look back at history, and we look back what happened in remote history, like in 2018, what you saw was a small bump in the spring, and we didn't get much of a reprieve for the summer. But this is really from deaths, and you know, and then they went into the fall, and it was, you know, it's 5 times worse. So can you imagine 5 times worse in the fall than we have now? So that would be really difficult, and that obviously just extrapolating from 2018. But then you also look at 2009, H1N1. When it came through, we had a bump in the spring, and then once school started back, that's a rocket, and that's really where it got us. So you know, I'm real worried. No one would be happier if we could be wrong about this than me, and I would love it. But there is no indication that we're going to get off the hook on this. And so one of the things that we're preparing for is for just for the healthcare system to be absolutely overwhelmed. And what do you do in those scenarios? And it's not just like you can build a hospital and create a whole bunch of nurses and doctors. There is a limited amount of expertise that you have to take care of people. And what you and I both want in a healthcare system is we want to have the standard of care. We want to have the right doctors, the right medicine, the right nurses, the right facilities when we need them. We don't want to be in some tent hospital somewhere hooked up to a portable ventilator because we've overwhelmed the system. Now, we can have that, but it is not ideal.
How much would you say the increased COVID numbers that we've seen would be attributed to the recent protests, or even just the public opening back up?
You know, it would be hard to say. I will say, of the protesters and all the pictures I've seen, I saw a lot of masks. And so I was really heartened to see that. So kudos. You know, we're not really sure. Certainly any gathering of close people, it doesn't matter why you're together. So we haven't seen anything we've attributed to that so far. It's a little bit on the early side. Sometimes it takes a little while to kind of filter out. But you know, outdoors is good. Masks are good. Crowding's bad. It just remains to be seen.
Talk about this, Mississippi's interaction with the White House, with the coronavirus task force and federal task force. We haven't seen press conferences here, and we haven't seen them in Washington either. We just happened to see Dr. Fauci today. It's been a long time. What's the interaction with the federal government and the state from your perspective? Is there still a strong dialogue about what's happening here?
Oh yeah, yeah. So, you know, CDC is our go-to, and we work very, very closely with them. And so, we've been encouraged to have increasing engagement as this goes through. Certainly, this is a stressful thing, and we know that they've had a lot of stress on them going forward. So, part of it's been a little bit interesting because some of it's been state decision making, right? So it's very good to have standards so that all the states can operate together. But the other thing that is kind of typical for public health is most public health authority does typically rely in states based on sort of legal structure of how public health works. So that's not too surprising. We're kind of used to running our own show. But you know, there's been some good stuff coming out of there. the consistency is important, and as we sort of know more, we're seeing more consistency, and that's been encouraging. But certainly, we welcome consistent, strong messages from all levels of government, with HHS, White House, and CDC. And then when they can align and have everything just clipping, that just makes such a big difference.
You talked about early on in this, South Korea, you highlighted their move to kind of slow the spread. Are you seeing some other trends around the world that have caught your eye that you think could work well in Mississippi now that we still have these increases?
You know, Hong Kong's not too bad. Taiwan's really shows a lot.
And what are they doing?
Well, a lot of it's just just the discipline for the social distancing. It's, you know, wearing the masks, staying away from gatherings. It doesn't mean you can't go to work. It doesn't mean you can't go to the grocery store. And they've had really good results from the simple stuff. I am perpetually frustrated by everybody. I mean, you don't have to shut everything down to slow down COVID, right? You can do real simple things and it would work. It would absolutely work. And so we're on this sort of schizophrenic roller coaster of shut it down and do nothing. There's a middle ground that is really where we want to be, and we just need to migrate toward that. Whether you're really worried or you're not worried at all, if we can just sort of come to some middle ground, we'll be in a lot better shape.
I have another question. I don't want to downplay the question.
Yeah, you do.
I really don't. I would imagine that African Americans still dominate the caseload, probably here in Mississippi. If you could speak to that, that would be great. But in all that's happening in this country after George Floyd, you know, there's systemic racism that's being called out in this country. People calling for change. Our health system in this state has been problematic, you know, historically because of that. What does the change look like in this state to combat not only COVID, but just better health outcomes for people?
Yeah, and it's been really good, a good exercise to further open our eyes about really what we're looking at. I think we were all surprised, honestly, that when we saw that African Americans were so horribly impacted by this virus. I'm proud that we were one of the first states to report on it, and certainly we've been very aggressive. I've got a great health equity team that's been out in the community meeting with leaders, setting up networks, making sure that communities have access to masks. But the foundational elements of society and the structural components of health and well-being are really going to be critical to achieving health equity, because if you don't have a healthy lifestyle, if you don't have access to good schools, if you don't have access to a healthy community where you can exercise, if you don't have access to a grocery store where you can get healthy food, then your chances of success are just going to be really so much lower. So although our eyes were somewhat open, and we have been working on this for a while, and we actually had reformulated our health equity office to be more proactive, this is just one more episode that reinforces the absolute critical need to address it aggressively.
Okay, anyone got any last questions before we wrap up? Jim, you good? Everyone good? Okay, thanks, guys.
Thank you all for being here. Appreciate it.